welcome to MedKids Provider Spotlight, where every week we are coming to you interviewing the most amazing private practices from all over the United States. Every week is amazing. We get so much great information and different perspectives from all different folks and different specialties. And today I have a really awesome special guest for you. I am very excited to introduce you to Dr. Sonia Kamboj. She is the owner of Breathe Easy Allergy and Asthma, located in Louisiana. So welcome, Dr. Kamboj. Thank you for joining us.
Thank you, Rachel, for that introduction. I'm so happy to join you guys today.
Yeah, I know we have so much to get into, and I'm so excited to hear a little bit more about you. And maybe we can start off that way. I would love if you could, tell us a little bit about your unique story. What inspired you to open up your practice?
Sure. So I am a New Orleans native and am born and raised here. Studied at Tulane for undergrad medical school, was in my residency when Katrina hit and was
Wow.
relocated. Yes. And was relocated to different cities during my training. So I got to explore different cities, see how different hospital systems work. I was lucky enough to land in some great spots, meet some amazing people. I finished my training at DC Children's and fellowship at Thomas Jefferson in Philadelphia. And I worked in Atlanta in private practice for a while. But throughout my travels and time, I just always missed New Orleans and realized that there was a need here for me to help and serve my community. So that's what brought me back. And I relocated here in 2014 and was able to open Breathe Easy Allergy and Asthma, which is still open and will be celebrating our 12-year anniversary this year in May.
Oh my gosh, congratulations. That's so awesome. I love to hear, everyone's stories where they've studied, and it seems like you've been to many different places, but nothing is quite like home, right?
That is true. I mean, I hate to be that cliche, but I think New Orleans is a special place and there's really nothing like it. So once you've lived here, it's just kind of hard to live in other cities, I feel.
Yeah, I totally understand it. I love your story and would love to hear a little bit more about maybe some of the common areas that you find people struggling with, and maybe even some of the uncommon areas. I think, sometimes we do things beyond what people think we're doing as a provider.
Sure. So this practice was created out of a desire to provide thoughtful personal care in a setting where patients feel heard and supported and understood. Many people with allergies and asthma have been struggling for years to find answers, and they're just told or they just think they should live with it. So this practice is centered on changing people's lifestyles and outcomes so that they have the right diagnosis and treatment plan, so they don't have to really live with their conditions. They can actually improve and thrive. So Breathe Easy Allergy, and myself, we try to give everyone a patient-centered experience because everyone's life, everyone's diagnosis, symptoms are different. So we really aspire to listen to the patient and provide a tailored medical care and regimen that everyone can live with and, improve with.
Yeah, I love that. And it's also so sad though that I'm so many people are just told to just live with it. Doesn't that infuriate you when you know there is a solution to when someone comes to see you and you're like, I can't believe that you were told to just live with it, you know?
Sure, because sometimes these symptoms are sneaky, right? You're just congested or you're just itchy or clearing your throat a lot. And one day you've developed, hives or asthma or a life-threatening allergy. So it's not always so overt. Sometimes the progression of allergic disease is actually a little what we call sneaky or insidious. It like kind of just surprises you until you can't ignore it any longer.
Yeah, that's a really good way to put it. And yeah, some of these allergies are kind of sneaky and they do kind of creep up all of a sudden out of nowhere. So that's really good to note. And in terms of, it seems like you're really, patient centered and you're really focused on, meeting their needs, meeting where they're at in their journey. But how would you say, your approach is different? You've been in business for going to be 12 years now. What do you think is your, like superpower? What is making you guys unique?
Sure. So I think our approach is comprehensive and individualized. We don't believe in a one size fits all treatment. Instead, we try to focus on identifying the root causes, educating patients, and having a custom care plan to fit lifestyle. So once we diagnose patients with what they are allergic to or what may be going on, I think the key is prevention. Okay, environmental controls, trying to cut out that allergen, but sometimes that's not possible. For example, if it's your pet or dust mites, which are common in Louisiana, you can't always get rid of your animals. You can't always move right away. You can't always get rid of your family member who's smoking, et cetera. So medical treatment also comes into play. And, we're fortunate enough that in 2026, we have desensitization protocols, we have biologics, which are targeted immune therapy. And some of these medications and protocols just really didn't exist when I was in training. So allergy and immunology is a really exciting field. There's so many new advances every day. So I think it's really important to be up to date and stay on top of all the new modalities too.
Sure.
And take time to listen, right? To see what it is the patient wants, because they don't always want to be on meds or biologics. Sometimes it's just, using an air filter or using an antihistamine is needed. So it just depends on what the patient is actually looking for as well.
That's interesting. I think not a lot of people think about the environmental factors, and yeah, you're right. You can't just eliminate your family member who is smoking,
No,
or
no,
your four-legged family member
yes,
that's been living with
exactly.
you. You know,
Correct.
those are a little bit more difficult than just saying, do this, do that. It's going to be so easy to get better. There's other factors in play, and you also talked about the new and different modalities that are out there to aid in treatment, and which kind of leads me to, is something that I'm very interested in hearing about from you is that I think every specialty is sometimes kind of plagued with a misconception. And you've talked about how far your specialty has come and research different modalities and are people maybe still stuck in the past of telling you about, oh, here's some old wives' tale about this allergy and how I'm supposed to help myself, or a friend of mine got this, very outdated test is, or I think it's outdated. Is this still relevant? So how do you handle, and maybe you can share some misconceptions that you're constantly maybe debunking in the office?
Sure. I mean, yes, there are home remedies, like honey, right? Which is fine, right? That's great. Use honey, but I don't think that's going to cure your pollen allergy, correct? Then there are some other misconceptions for food allergies, for example, that we're still learning about. And when I trained, we thought that we should avoid high risk foods for children. Now we know we should try to introduce them safely as much as possible, right? So that's a big example of how our field has just shifted completely. So it's also very important to keep up to date on these new guidelines, right? And identify what you can offer your patients as well. There's other myths that you may just outgrow your allergies. Sometimes you can if you move, correct? If you move to a different part of the country, for example, people develop a lot of allergies when they move to New Orleans, right? We have a very unique ecosystem here. We have a lot of humidity. We
Yeah.
have a lot of water damage from storms. Okay. So dust mites and molds are more rampant here than other parts of the country. Also, we see a lot of changes with wet climate change. Also, we see pollen very early. We see pollen staying in the air more resistant than it used to be. So, I mean, in January, we already have pollen, which I know is something, really novel for all the people who are, still covered in snow and having sub-zero weather right now. But we're just a very unique city. So I think it's hard for people to adjust here and understand why they're developing all these symptoms. For example, I had no allergies my whole life until I moved back to New Orleans, right, in 2014. So I actually can commiserate with my patients that I've also developed those allergies that did not bother me in the other cities and states I lived in. But it's just a unique place. So our bodies, our immune systems are constantly changing. So it's just important to identify all those triggers and factors as well.
Absolutely, yeah. And I think you're right to say that every environment is totally different. And it's very interesting to hear about the uniqueness of New Orleans and being maybe plagued a little bit more by mold and being more in a wet environment. And it was funny, I was talking with a dermatologist who's you know, in Canada, Alaska, and he often for him misconceptions are people don't need to see a dermatologist because there's not a lot of sun. Wrong, right? And so
Right.
I think that's, maybe similar for you is that people may think, differently about the environments that they're in and may not think things are affecting them as much as they are. But yes, that's a big role to play. So I love the misconceptions, especially about the honey. I hear that quite a bit, and so I was wondering if you were going to bring that up because it is true. There's a lot of people that you got to get the honey that's more local to your area, and that there's all these honey myths. So I was yes, as it may help, but it's not going to be the cure all.
Sure, because if you think about it, most of our pollens are pollinated by wind, right? Tree pollen, ragweed, grass. So although honeybees are doing a very important job, their honey and nectar that they produce, it's just a drop in the bucket, right? When you think of the grand scheme of pollination patterns, et cetera. And again, in New Orleans, it seems like we have pollen 9 months of the year or longer, actually, since we now see it in January. And I can just see in my own career and the start of my practice that it has gotten earlier and earlier. Like I've never seen January pollen counts, okay? And that seems to be more of an occurrence. New Orleans is ranked the #2 allergy capital in the US, okay? That
Wow.
was last year. We'll see what happens again this year. And I also see that children, they develop all these symptoms quite early and progress so much more rapidly. And again, I've practiced in 3 other cities, right, in 3 other parts of the U.S., and I just didn't see it happen so quickly as as I've seen here. So I think early detection, early intervention really does help children, especially because we don't want them to suffer and make it to the emergency room or develop asthma and infections. So
Yeah.
all of those things are important, early detection and intervention, especially.
So important to hear. I
Mhm.
don't think a lot of people are thinking about that maybe when, they're experiencing their allergies or are taking care of a loved one or having children. And like you said, it's important to know and these updated protocols on how you should be introducing things. And hopefully that will you'll have to endure less later on.
Yes.
And be better for it. But because you've given us such amazing tips and, telling us about all these different misconceptions, I was wondering maybe if we could round out today and learning about Dr. Kamboj's like pro tips all around for, maybe some more that you can give to maybe a patient that you would see, and what are some things that we can do for, moving forward to move our health in a better trajectory. And then, maybe there's something that you can share, since you're a veteran, business and practice owner, for 12 years, maybe you can share something with folks that are, whether they're starting out new, or we can always teach an old dog new tricks. I think there's probably things that you're doing in your business that help you every day, that are important maybe for others to take a mental note of and say that's a really good idea.
Sure. I think communication with your provider is always important.
Mhm.
We don't always know if you have filled a medication or if it's not working or if something has changed, right? So luckily, most practices have like a portal type system, right, where you can communicate your, you know, questions or changes or reactions, etc. I think being proactive with your symptoms and identifying different patterns really help. So in New Orleans, it's almost every day and every patient that I discuss an air purifier, right? Or free and clear skincare. I talk a lot about people being a little discerning with supplements that they may use, right? That they might find on TikTok or Amazon. I see countless reactions, right, to medications, or sorry, I shouldn't say meds, but supplements.
Mhm.
And we have no way of testing for it. So just,
Sure.
be a little discerning with what you take. Just because someone has a good reel and a website doesn't mean you should take sea moss or elderberry in very high, amounts, or just because you like Indian food, you shouldn't take cumin all day, right? And there are a lot of side effects with natural care. So just always kind of disclose that to your physician as well. And then also not waiting until symptoms are severe to seek care. I mean, we're all guilty of this. Everyone's busy,
Mhm.
but just, listening to your body when you have small flares or minor reactions so that we can actually prevent you or help you from going to the ER or having something serious. And I guess the my tip for private practice and business owners is to make it your own. Never stop having fun, enjoy your patients, enjoy your team, because it's actually a privilege to take care of patients. It's a privilege to shape something in your own identity and vision. And not everyone gets to do that. So,
Mhm.
I mean, I've learned a lot. It's been quite a journey, and I wouldn't have traded it for anything, because every day I learn something new. It may not be from patients even or medicine. It's just maybe, from the day to day, what we see in private practice is day to day experiences.
I love that. Such great pro tips for everyone, and especially in talking about supplements too. This is why I love Provider Spotlight. These questions, everyone answers them so differently, and I just love your take on, it is true. Like not, you could be overdoing something that is seemingly has good benefits for you, but you're overdoing it, and that's causing other
Mhm.
issues, right? And we don't think about that so much. Sometimes yes, we're guilty. We see something online and it's branded as this great and amazing thing, and we overdo it, or we're a victim of marketing. So,
Sure. And I think that just comes to mind because these kind of things, I think, come in waves. Like there was one week where I think every day I saw someone who had a severe reaction from some type of supplement that they, use, and they thought in good faith, they thought it was helping them. But the label is in a different language, right? Or you look at the ingredients and it's all preservatives and things that shouldn't be used, especially in teens, teenagers and young skin is still developing. They shouldn't be on, I mean, my opinion is they should not be using anti-aging type of products, right? But it's hard. We're all victim to good marketing. We just have to be a little more discerning. Same thing with supplements. We saw like lots of off-label uses during COVID, and even now, people are interested in natural alternatives, which is fine too. But just do know that all of these supplements, some of them do have reactions associated with them, risks associated with them, and we can't always test for it, right?
Yeah.
So it's just, a little bit of just identifying these things or goes a long way.
Yep. And like you said, communicate with your provider. I
Sure.
just to have that strong relationship, and I know you appreciate that so much as to someone that comes to you. And it's okay to look something up and have a question on it, but also trust the process and the person that has, as your beautiful diplomas are in the background, someone that has spent a lot of time and care and learning about something, and to trust their process and to know that they're doing right by you and they took an oath to do so. But yes, Dr. Kamboj, this has been so amazing. Thank you for all of your expertise, your time with us. Before we leave off today, I would love if you could tell folks where they can get some more information, reach out to your practice, and just get some more resources.
Sure. So the name of our practice is Breathe Easy Allergy and Asthma. You can follow us on Instagram, Facebook, or visit our website. We have lots of self-scheduling features. You can always reach out to our staff with questions as well. And I guess, our mission is to help you breathe easy in the big easy. So that is our vision, and that is our goal, and why we are here to help you guys. And again, I'm very privileged to be back in my hometown and taking care of my community. And I enjoy what I do very much. And I'm happy to, help and reach out to other people who may need more assistance with their allergies and asthma as well.
Thank you so much, Dr. Kamboj. This has been a pleasure,
Okay.
and we hope to have you on again soon.
Thank you, Rachel. I appreciate it.
Anytime.